Hi, my name is Dr. Gil Lederman. Recently we were asked for our patients to describe their experiences here at Radiosurgery New York while getting focused beam, stereotactic, pinpoint, non-invasive treatment. Many of our patients were eager to respond, and respond they did. Dozens and dozens of patients wrote about their experiences while getting radiosurgery. I've asked Sarah to read to you their exact words and descriptions of experiences during radiosurgery. Why are we relating this to you? Well, we always feel that the more information you have, the better. And these are the words of patients. Of course, you can come here and see the patients and sit in the waiting room and talk to other patients also. Obviously, if you have a cancer or suspected cancer, it's best to come here in person. You can meet our staff, we can meet together, we can spend time together and try to decipher what you have and what are the treatment options. If you have medical questions, it's best to meet in person. We also have information, booklets, DVDs available for you and your friends. We know many of the people that we communicate with also offer this information to their neighbors and family and loved ones. Again, thank you for watching, and I wish you good health always.
Hello, my name is Sarah, and I work at the front desk at Dr. Lederman's office. Today, I will be reading some of the testimonials of a few of the patients that walk through our front doors. Dr. Lederman reassured me that cancer can be gone sooner than later. When I started here with Dr. Lederman, I was very sick with gallbladder cancer. In fact, I was diagnosed of this disease and did not know what to do until I heard Dr. Lederman on the radio one morning. I picked up the phone and called his office. They took me in right away. After all the consultation and evaluation, Dr. Lederman programmed a personal treatment for my gallbladder. I give him a 5 out of 5. I recommend him to everyone. He is saving lots of lives. Dr. Lederman is very professional in his approach. When I arrive there is usually no wait. Health-wise, I find myself getting better. I am now able to do things that I couldn't do before. Another patient said, Dr. Lederman helped me a great deal. He makes me feel comfortable. He explained my problem to me and how he's going to treat me. He's also a caring doctor. His heart is in his work. God bless him. I trust Dr. Lederman. Wish there were more doctors like him. Dr. Lederman is concerned about his patients and completely explains the procedures involved in getting rid of cancer by his radiosurgery treatment.
Hello, I'm Robert Mashburn.
And why are you here today?
I'm here to get my treatments for my prostate.
So tell us, how old are you?
I'm 72 years old.
And where were you born?
I was born here in New York City.
And have anyone in your family ever had prostate cancer that you're aware of?
No one, man, no one.
So how were you diagnosed with prostate cancer? How did you become aware that you had a prostate problem?
Well, I was told by the doctor, I had to have a large prostate.
So your prostate was enlarged.
A large prostate.
Had you been following that or following your PSA over time?
Over the time was, well, I think maybe over the period of 5 years, and it was okay then.
So the doctor did a biopsy,
and he told me that I might have, if I have cancer, he's gonna, what they'll do, they'll cut the prostate and give me radiations. And
so he wanted to do both surgery and radiation.
Right.
And was he going to do the surgery himself, or was he going to send you somewhere for the surgery?
I guess he was going to do it himself.
And why would he do both surgery and radiation? Because usually you choose one or the other.
Yeah, I don't know why, but I know when God sent me you, because I was driving the car and the radio came on and you was on there, and the way it was explained to me that the radiosurgery would be the best thing for me.
Okay, so were you going to have surgery up to that point?
No, I was getting a second opinion. That's why I came.
So you didn't want surgery anyway?
I didn't want surgery. Plus the after effects he was telling me, I couldn't deal with that.
What did he tell you about the side effects of surgery?
He says side effects, would be like I will have problems urinating. I might have problems bowel movements. He says I could have problems, and I won't have problem with my sexual life.
So those were big negatives for
Those
you.
big negatives for me. I don't want to be no invalid. Yeah.
Did he tell you that in general, surgery results are not as good as our results? Did he tell you that one? For curing the cancer, or trying to cure the cancer?
I brought something up to him. I asked him about the radiation. I said, "Do you when you give radiation, how do you give it? You give it to the prostate, or do you do it like the go directly to the prostate?" He said, "We just get the big area."
He's in a big area.
A big area.
And that's in this day and age, right?
Yeah.
And he was going to do in this day and age surgery and a big area of radiation.
Right.
And so you ran away from there.
I ran away.
Have you ever gone back to him since?
No, I haven't.
Would you ever go back to him again?
No, I won't.
Why?
Because I'm staying here with you.
Okay. Now you've started your treatment here.
Yeah.
And what's your experience?
Oh wow! I tell you, the fear I had then, I have no fear now. Of my confidence is in you. And
What are you feeling each day you have the treatment? What do you feel? Do you have any negatives, or you just go home or go do what you want to do?
well, the only negative I have is like with the little bit of radiation that you give me, my urine doesn't come out, and you told me that's normal for right now. And other than that, I'm great. I get up in the morning. As a matter of fact, I'm retired, and I haven't been getting up at 6 o'clock in the morning to come down here early. I haven't been getting up 6 o'clock in about maybe 10, 15 years, and I feel good. I feel good doing it.
But you're urinating on your own.
I'm urinating on
so you're
my
urinating
own.
on. You have a little bit more frequency of urination, but you're doing everything on your own.
Right, on my own. Everything is just on my own.
Okay. There's no hair loss or nausea or vomiting or anything like that.
Nothing like that. No.
Have you met other men here who are getting radiation or who've had radiation for prostate cancer?
No, I haven't met anyone here.
So you don't speak too much.
I don't really know. I
Yeah.
get out and go.
You come and go.
Yeah.
How long is the treatment for you?
The treatment lasts maybe about 5 minutes.
So it's very quick.
It's very quick.
Do you feel anything during the treatment?
Nothing. No.
Is there any negatives during the treatment?
No negative, except maybe the little skinny robes you get on. I can't hide myself.
Skinny robes? Well, not all of us are so skinny. You have to work on some big sizes, normal sizes.
Yeah.
How's the staff with you?
Oh, the staff is wonderful. They're great. I tell you, they're something else.
What's your expectations now?
My expectation is that I'm going to be cancer free. If not, I'm going to be maybe another 20 years on my lifespan. So you figure I'm 72, so that makes me be a good age up there.
All right. Well, thank you very much.
Okay.
What would you tell a friend or neighbor who has high PSA or prostate cancer? How would you tell them? Would you advise them, or would you tell them each man has to decide for themselves?
I would advise them. I would tell them to come down and see you or listen to your station, and you'd be surprised. It's like a God gift, because I tell you, the radio station hit me, and it was like telling me, here's something, because I was wondering, how would you, that cancer is something. And with the modern age today, the people are doing things like the old days, and you're coming out with, you got a technique that, hey man, you God gift.
Thank you. Tell me something. Do you listen to the radio show every week, or was this by chance you?
This is by chance. I just so happened, to listen to it, because I know a friend. There's a friend of mine that had cancer, and he died and everything, and I was just thinking about it. Here I am, 70-some years old. I said I could have cancer too. But at this stage, I said I can't be going through no changes like the way he was going through it, irregular testing, and he looked real bad with this the radiation and everything. He was real weak and everything, so I don't want to get like that.
That was regular treatment.
Yeah.
Tell me something. You listened to the radio program. Did you learn things from it other than coming here? Was it educational for you?
It was very educational, because some things that I wanted to find out, you brought out, and that cleared my mind up, and everything educated me to the point where I had to come and see you. You was my only hope.
Do you ever listen to the radio show again since that day?
Oh, you better believe it.
All right, thanks a lot.
Okay, now.
Okay, God bless you.
Okay, thank you.
Another patient writes, "He provides a treatment that is hopeful for me. He allows me to ask questions and make choices." Another patient writes, "Dr. Lederman is very helpful and has a lot of patience and understanding for a serious setback like cancer. Glad I am one of his patients." Another patient writes, "It pays to advertise. Had Dr. Lederman not advertised on the radio, I would have never heard of him. I feel confident because of his concerns and the ability to give me the help I need. Non-invasive surgery is what caught my interest. Dr. Lederman practices what he preaches. I am quick to recommend his services to others, sharing the knowledge I gained from Dr. Lederman." Another patient writes, "My nasty cancer has spread rapidly, and Dr. Lederman has identified all the tumors and is knocking them off one by one, thankfully." Another patient writes, "The attention I have received from Dr. Lederman is excellent and reassuring." Another patient writes, "The attention I have received from Dr. Lederman is excellent and reassuring. Dr. Lederman is a real caring man. I have not begun my treatment yet, but I am confident in its utmost success."
My name is Jean F. Lamotte. I'm from the West Indies. I'm from Haiti. And it seems to me, up to now, without no doubts, I have the best doctor in the world, Dr. Lederman.
Well, we have to prove that over the next 20 years, right?
Well, I wasn't feeling too good at all, but since I started to come over here, I'm feeling much better.
Why don't you tell people why you came here, what was your situation, and what led you to the doctors, even before you came here?
Well, before I came here, I wasn't feeling too good at all.
Why?
Because the cancer was getting worse as it was.
What kind of cancer did you have?
Prostate cancer.
So you were diagnosed with prostate cancer.
Yes.
And what were your symptoms?
Like I cannot eat, I cannot walk that much. I was everywhere I go, I feel like I'm tired and things like that. And it looks like it doesn't happen no more.
Did you have difficulty urinating?
Not exactly.
Did you wake up at night to urinate?
I do. I mean, sometimes 2-3 times a night.
Now you saw a surgeon who did the biopsy on your prostate, right?
Yes, I do.
And did the surgeon want to do surgery on you, or what did the surgeon tell you about
Well,
treatment options?
then we never talk. We never get that far surgery is concerned.
Well, he told you you had cancer,
But I
right?
thought I have cancer.
And what did he say after
He
that?
said he was going to recommend me to one of the best doctor, prostate cancer
To
doctor
do
in
what
the world.
to do what kind of treatment?
Radiation
Uh-huh.
and everything else concerning my case.
So why did you come here?
I came here because I'm looking for a very good treatment, and as far as I'm concerned, my primary doctor told me I'm going to send you to the best radiation doctor in the world, Dr. Lederman.
That's why you came here?
That's why I came here.
And when you came here, we met,
Yes, sir.
and we showed you the data, the chance of being successfully treated, right?
Yes.
Were there any questions that were not answered? Were all your questions answered, or were there anything that was not done
up
right?
to now, I don't have, without no doubt, I don't have no complaint.
Okay, now you had just a treatment for your prostate cancer a few minutes ago, right?
Yes.
So what does a treatment feel like?
Well, to tell you the truth, it's hard to say it, but since you're not a doctor and things like that, but I feel good about that. The
You had a treatment,
is very good.
but
Yes.
just 5-10 minutes ago you had a treatment, right?
Yes, I do.
So tell people how you feel, and do you suffer from the treatment, or you feel nothing from the treatment?
No, I don't feel nothing.
You feel nothing?
I don't feel no pain, none whatsoever. And I'm feeling great.
So you got off the
Since
treatment,
I came here.
and you can do anything you want today after a treatment. You can do
I would
anything
say
you
that,
want.
yes, I can do anything I want at any time at this time. I can walk a few blocks without no pain, without not being tired and things like that.
Are there any limitations in your activities after your treatment?
Well,
After treatment, because of the treatment,
because of the treatment, I feel much better.
you feel better.
I feel much better, a million times much better.
So there's nothing negative about the treatment.
No, not at all.
What's your advice to other people who have cancer and prostate cancer? What would you
Well, I
tell
would
them?
advise anyone, anybody, any man who suffers with prostate cancer, the best doctor you have to see, Dr. Lederman, is the number one in the world at this time for me.
Well, you're very generous.
Yes.
All right, thank you very much.
A middle-aged man from Brooklyn, New York stated, "Dr. Lederman has helped me deal with my cancer in a proactive and positive way by eliminating the disease. His progressive way of treating cancer through pioneering new methodology has given me more hope through realizing unconventional possibilities. This pioneering spirit is reflected in his young and helpful staff who consider their work a mission and not just business as usual." Another patient wrote, "The knowledge that he showed about the cancer, the procedure, its success, the prognosis, and hope for a longer life has really removed the anxiety and fear that I had when I was first diagnosed. In the interview of the treatments, I had questions about the difficulty of urinating, and he was there for me with addressing and helping solve my symptoms. He really helped me to be more concerned about my health." The brother of one of our patients wrote, "Dr. Lederman has been very helpful to my sister and I, given information about her condition. The staff and the technicians have been very helpful." Another patient wrote, "When I first heard about Dr. Lederman through a friend of mine, I knew God was leading me in the right direction. He is so helpful, kind, and caring towards his patients. The staff is also helpful and caring. I appreciate the treatment that I'm receiving, and he answers any questions that I have. He would do all that he can do to make sure I am doing well. I must say, I appreciate his service." An 82-year-old man from Yonkers, New York stated, "Dr. Lederman gave me hope when I had none." Another patient wrote, "When I came to see Dr. Lederman, I was in bad shape, and Dr. Lederman has changed my quality of life, which is very important to me."
How are you, John?
How you doing, Doc?
So there's lots of people curious about why the heck you are here.
Yes, Doc. I looked in fine fiddle, but I had bladder cancer.
Okay, so you came here with bladder cancer, right?
Yes, I did.
So it's a cancer of the bladder that was invasive.
And also the urethra. It was the urethra.
Okay, let's talk about 2 years ago when you first came here. Was it 2 or 3 years ago?
About 2 or 3 years, just about.
And at that time, you were diagnosed when you had, what, blood in the urine or?
Blood in the urine. I was urinating blood. I was urinating pure blood.
Okay,
there was no
and-
urine coming out.
And you went to the urologist, the
Yes.
urinary doctor.
Yes.
And he diagnosed you with a bladder cancer,
Up
right?
at, yes.
He was offering radical surgery for bladder cancer. Is
Yes,
that correct?
that's the only thing he offered me.
Did he offer you any other options?
None whatsoever.
Did he ever talk to you about non-invasive treatment?
Never mentioned it at all.
So all he talked about was removing your bladder.
Yes. And give me a
And-
bag on the side.
And did you agree to that?
I did not agree. I says I have to talk it over.
And what
And
happened
I left.
next?
He says I'm going to speak to the head of surgery here next week, and I want you in the hospital next week.
But you didn't have that surgery, right?
No, I did not.
Why?
I in my mind as I was walking out of the hospital, I says I know another way. I know another way, and I heard Dr. Lederman on the radio. And subsequently, it popped into my mind, and I dug up his address, and I came.
His address is me. Okay, so
came to-
how did you found out about us through the radio?
Yes.
And you came here.
Yes.
We met a couple of years ago.
Yeah, and I gave you my disc, my
Right, we went all over
my
documents.
things, and Dr. Lehman says we can accommodate, and I says thank God.
Okay, so you went through treatments here a couple of years ago.
Yes, sir.
What was treatments like for bladder cancer? What did you
It
feel?
was I was really shocked because I was usually getting put in a hospital and being operated on.
Well, that's not here. You weren't in
Not
the
here.
hospital
I didn't
here.
go. He told me you come in for treatment. He put me on the scanner and measured me up and put me on a table. In 10 minutes I was through, And he says, all right, go about your business. Come back next Tuesday. I says, all right, Doc. And I went across the street to Macy's, and I was shopping for a suit at the time.
So the same day you were here getting treatment, you were over at Macy's shopping around.
10 minutes later, Doc.
And what was the treatment like? What did you feel for treatment of
the
bladder
treatment
cancer?
was just like getting an X-ray. I laid down on the table, and the scanner came over me, and bang, bang, bang.
Was it claustrophobic?
No, it was not.
Was it painful?
No, it was not.
Was there any cutting or bleeding?
None whatsoever.
How long did the treatment take?
10 minutes.
And after the treatment, you got up and went and did what you wanted?
And 10 minutes later, I was in Macy's, in crowded Macy's, because it was around the holiday season, and I was trying to buy myself a suit because I had nothing but rags. I was homeless for a while, and then I managed to I wanted to put my wardrobe together, and that's what I was doing. If you have any sort of cancer, I would advise anybody to talk to Dr. Lederman, because I think he could find a better way for you.
Well, not always. We don't always find a better way.
Well,
but in your
I
case,
think, yeah.
But in your case, you were going to lose your bladder, right?
And my life probably would have been shortened, and more than likely, I probably would have. I wouldn't have been able to here to talk to you like this because I wouldn't have been able to function. Staff was fantastic. I'm telling you, you've never seen anything like it.
Were there any negative things, difficult things? during the
None
course of
whatsoever.
treatment?
The staff was beautiful.
Communication was okay?
Communication was great. The communications and they treated you like a cancer patient.
Well, I don't know if that's a good thing or bad thing. They should
Well,
treat you like a king.
Well, it's good because they give you a little consideration and you're able to function a little better, and it's a real professional operation, more so than I've seen in hospitals. And I've been in a lot of hospitals. I've been shot twice, and I lived a real rugged type life for most of my existence.
How's your urination now?
Fantastic.
So the bladder's working, you urinate when you want to, and you don't urinate when you don't want to?
That's right.
And the bladder cancer has been in remission now for about 2.5, 3 years, correct?
Easy. And I urinate fine. I got no problem with that. I'm 70. A man is 71 years old, and I thank God when I stand by the bowl.
A middle-aged woman stated, Dr. Lederman has been a great doctor since I began treatment. He was very informative of the treatment and very positive with my recovery. Another patient wrote, it's a pleasure to go and get help by Dr. Lederman. He's very helpful, informative, and patient. The staff are the sweetest people. Honestly, I'm extremely satisfied with his services. A young man from Lodi, New Jersey stated, I have noticed some changes but need some time for radiation to do its job. I have faith that Dr. Lederman will be helpful for me. A young man from Brooklyn, New York stated, he's a very good doctor who explains my diagnosis very well. I am very happy with him. There are no problems whatsoever. I love his hospitality, kindness, and respect for me as a patient. A young woman from Woodside, New York stated, Dr. Lederman is very kind and reassuring. He's very pleasant and nice. He's been providing the best care for me and his patients. He has very well-trained and courteous staff. The technicians show experience in their work. The center is always kept clean and well ventilated. May you have many more years of excellent operation. A young woman stated, Dr. Lederman showed me I didn't have to lose my bladder. Conventional medicine treatment was surgery and a bag, and removed my 22 lymph nodes. He made me feel at ease on my first appointment. Another patient stated, Dr. Lederman is very helpful. He is attentive and very caring. I am blessed to have his medical services. Another patient wrote, Dr. Lederman has been very helpful and understanding about my condition. He is very patient and listens to questions that I have for him. His staff is also very understanding.
Thanks for watching this DVD. I hope it was interesting to you. We obviously have more information for you. If you have a cancer or suspected cancer, it is best to meet in person. You can just call our office at 212-CHOICES. That's 212-246-4237. Our website is rsny.org, and my email, and you're welcome to email me at gil@rsny.org. Again, thank you for watching. If you have other questions, it's always best to meet in person. Thank you, and God bless you.